and then if they can't afford, then you set up a system to make sure that other people pay for it. So now you have, the welfare system, you have Medicare, Medicaid, you have insurance, you have all these different things, and then these systems will only allow certain types of treatment. So they create a whole business model around this where they can then manage the care versus curing.
I was just asked the other day by someone new to us if I was the forbidden doctor. Well, of course, I said no. The forbidden doctor is not me at all.
We are not the forbidden doctor. Jack is not the forbidden doctor. It's in you.
The forbidden doctor is that magical, mystical power inside of you that is controlling and healing everything.
It's that beautiful, marvelous, almost miraculous force that controls all healing.
It's that innate intelligence, that life force-directed influence that triggered your DNA to guide the building of your body after conception.
Yeah, it's that power that sustains your life, repairs your wounds and lesions, and it never stops working. It's that essential part of you that keeps you alive and heals your every hurt.
This is the forbidden doctor. It's not me. It's that part of you the powers that be have decreed forbidden to ever learn about or even consider, and never ever rely upon. For it is forbidden that you even know this life force exists at all.
You are your own forbidden doctor.
Yes. Hey, everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 186, Cutting Edge Integrative Cancer Care with Dr. Michael Karlfeldt.
We'd also like to introduce you and reintroduce you to our new rewards program, Cashback World, where you get cash back on your online purchases from Forbidden Doctor and purchases in stores, big box stores, mom and pop stores, and you also earn shopping.
In 450,000 locations.
Yes. And you earn shopping points that you can use for about every $50 you spend, you get a shopping point, and they're worth about $10 on average, $10 a piece.
In redemption value, yes.
And when you shop at our store, the Forbidden Doctor online or in our clinic, you get 3% cash back and 3.5 shopping points for every $150 you spend.
Right.
So that's a lot of extra cash just for doing nothing more than shopping. So they're also the sponsors of our podcast. And so, the sponsor doesn't just help keep our podcast on the air, but it helps you, the listeners. This free app gives you cash back in your pocket when you shop, and all you have to do is shop. So why not use this free app and get cash back? Go to whynotgetcashback.com to register. Click on one of the little yellow register buttons and download the free cashback app and start earning money.
Should we say what's going to be advertised on our webpage here very shortly?
Ooh, yes. Go ahead.
Yeah, standard process. Standard process that we have been talking about for almost 2 decades now on the radio and on podcasts. We are now getting a clear hand in the next week or two.
They have opened up the corral. They have taken off our handcuffs.
So we can directly advertise and sell standard process on our website.
Meaning that you won't have to take the symptom survey.
Yeah.
We think you should take the symptom survey. I think you get better protocols and better advice, but you won't have to. So you can tell your friends and family to go to forbiddendoctor.com and they'll be able to purchase without a symptom survey.
Okay.
But
sounds good.
Couple weeks. Give us a couple weeks.
Yep. So we have with us today Dr. Michael Karlfeldt, who has a naturopathic clinic in Boise, Idaho.
Not too far from us.
And we will be talking about an integrative approach to the treatment of cancer. And we want to add at this point that the Forbidden Doctor does not treat cancer. This podcast is for informational purposes only. If you are currently under the care for cancer, anything we discuss today needs to be shared with your medical oncologist for further understanding, as this interview is not intended to be taken for cancer treatment of any kind. Now, throughout the world, There are many approaches to cancer that have gained increasing medical research funding to further understand their success record in supporting the body's defenses against this terrible disease. These many varied approaches merit our attention.
For sure.
So this is what we want to learn from Dr. Karlfeldt today. So welcome, Dr. Karlfeldt, to The Forbidden Doctor.
Well, thank you so much for having me on the show today. And I just wanted to say that I really enjoyed the definition of Forbidden Doctor. And people, they're so focused on symptom management.
Yes.
And they forget the incredible intelligence, that innate intelligence that each individual has that really drives that healing force. And that is what's keeping us well. It's not man-made pharmaceutical drugs that is the intelligence. It's turning on that healing power within us. That is where the true healing is. I thoroughly enjoyed your definition.
Given it the nutrition to be able to do these biological functions, which create the...
Yeah, we kind of have a two-pronged approach. Number one, get rid of what's stopping the body from healing itself, and then provide it the raw material it needs to heal itself. And it's amazing what it builds itself. It knows how to heal itself. It just needs the tools.
Absolutely. And that is exactly when you're dealing with cancer, is that you want to look, there's always a causative factor. Disease does not come just because. There's always a reason behind it.
Yeah.
And yes, you want to use pharmaceutical drugs and to manipulate the symptoms. That is what the medical doctors do. But you want to go deeper than that.
Yeah.
There is a reason for disease to occur. And you want to find that reason, correct that reason, and then also correct the dysfunction that reason has caused.
Well, we always say enjoy the peace that comes from foundational healing rather than the useless frustration of managing symptoms.
Yeah,
that's perfect.
Yeah. And one of the issues with today's world is that, we're exposed to chemicals. And while we're exposed to more stressors, like chemicals, we're also getting less nutrition.
Yeah.
We're getting less light. We're getting less good quality water.
Polluted
We're getting
air.
less oxygen.
Yes.
So these fundamental pieces we are so deficient in, while the stress on our bodies are increasing more and more. So because of that equation, it's tilted so much in the wrong direction. That's why we see this increase in these chronic diseases like cancer, like autoimmune disorders, neurological conditions, MS, lupus, Parkinson's, etc. It didn't used to be this way. I mean, the level of chronic diseases is increasing exponentially.
Yeah.
And we need to change that tide.
I would like a little background, too, of you before we jump into this incredible concept, where you came from, a little bit about your clinic and what goes on with all of that.
Yeah, I've been in the clinical practice for about 30 some years now.
Okay.
And, seen hundreds of thousands of patients. And the reason I get really passionate about cancer is my father, and this was early in my career, he passed away from colon cancer. So I have a personal connection with this specific condition. I started my training in engineering in Sweden. So I was born in Sweden, got trained in Sweden, and in Sweden I had a father figure that I really connected with, and he was one of the leading naturopathic doctors in Sweden. And as I was studying to become an engineer, he said, well, come and see what I do. See if there's something that fits you. And I really loved the impact that he had in people's lives, where you can then bring them back to healthy living, healthy thinking, and seeing then things like arthritis, conditions that you think are permanent, then just disappear because the body continually repairs itself. It has that regenerative power. So if you just support that process in a natural, fundamental way, you allow then the body to live healthy. And we're supposed to live healthy.
Yeah. I mean, every force, I always say, has an opposite and equal reaction.
Yeah.
So in my opinion, a lot of life-saving pharmaceutical drugs creates a tremendous force in the body. They do work. That's why they're so deceiving, but they're not truly healing. And that's what I like about the naturopathic aspect of medicine that you have, is that you support the body, just as you said, and let the body do the miraculous stuff that it does, as we talked about in the beginning.
We're going to be talking about cancer today, and ever since Nixon declared war on cancer in the early 1970s, the whole orientation and the billions and billions of dollars that have been spent have been looking for that magic bullet.
Yeah.
And it's kind of got the cart before the horse. Rather than, as you two have all so eloquently already described, the causative breakdown in the body's own defenses that allow this terrible condition to occur, mostly from environmental factors that have a compounding effect when coupled with our own states of malnutrition. There's not a magic bullet. There's a system of several approaches that can be used depending on the kind of cancer, depending on the age, depending on of the patient, depending on other kinds of factors that might be involved. And as I look at what they're doing in Mexico, I look at what they're doing in Europe, and I read this kind of stuff, I see what they're doing in the Orient. Usually, the closer one is to the processes of Mother Nature, the more effective these things can be in the outcome.
Absolutely. And what I said, we run an integrative clinic, which means that I do have medical doctor on staff. Mm-hmm. I do have medical oncologist on staff. Mm-hmm. So we work with patients that go through chemotherapy, go through radiation, go through surgery, or if they choose not to. So the key is to understand that these harsh pharmaceutical drugs or harsh therapies, you can't just throw them completely out. So they do have a place, but it's to recognize that they are for a season.
Yes.
They are not there to heal you. They are there to manage the symptom picture long enough so that while you do that pharmaceutically, you need to then build up the foundation of health so that the foundation of health is strong enough and you remove the pharmaceutical intervention and the body can then start to heal and stand on its own. Speaking
of standing on its own, like you said, when you break a bone, you wouldn't just, get food to fix that bone and try to find herbs. You need that medical intervention to set the bone first.
Yeah, you probably need a cast.
Yeah.
You probably need some inactivity for a few days or a week or so. And then you start supplying the body what it needs to heal itself.
Exactly, but you don't walk around with a cast the whole time.
No.
When the cast has fulfilled its function, then you let it go, and then you support that bone nutritionally. And it's the same way with pharmaceutical drugs, is that they may have a season, and a lot of times you can then use natural interventions without even having to go in that direction. But when you talk about something as extreme as cancer, sometimes you need that. And looking at the therapies that exist currently in traditional care, Nixon declared the war on cancer and see how well we fought that war. I mean, cancer is increasing tremendously. We're looking at almost 1 out of 2 is going to be diagnosed with cancer at some point in their life, and 1 out of 4 is going to die from cancer. So we're not really effective in medically to take care of cancer.
Yeah, 100 years ago, it was 1 in 20.
Yeah.
Back in the 50s,
the 40s,
when I was born, was it the 40s? It's about 1 in 16, something like that.
We're getting
1 in 12, and then it got to be 1 in 8, and then it was 1 in 6, and now you're saying 1 in 2.
Yeah, we're approaching 1 in 2.
Yeah, Dr. Thomas Cowan, in his new book, which I would recommend everybody reading, Cancer and the New Biology of Water, he says 1 in 3 right now, but we're approaching, like you said.
Well, there's some states in the union right now where cancer has surpassed heart disease as the number 1 killer.
Yeah.
Even though heart disease is still considered number 1, there are some states where cancer has moved ahead of heart disease.
Yeah, and it's just a proof of our unhealthy living.
Yeah,
and it's a proof that whatever we're doing, thinking that we can use pharmaceutical drugs to correct physiological dysfunctions.
The problems of starvation.
You can't. you need nutritional intervention because our body functions on nutrition. Building blocks are nutrition. It's not a chemical pharmaceutical drug. We're not Prozac deficient. We're not anti-inflammatory or opioid deficient. We are not born with these deficiencies. So to correct a dysfunction using something different than what the body is made out of doesn't make any sense. But because we keep trying that and we think that this is scientific, we are then driving a normal disease to become more chronic.
Yeah.
Because we are symptoms are how the body communicates as to what it needs. So when we have pain, we have fever,
Beautiful.
Low energy, all these things. This is the language that the body uses to communicate as to what it needs. And if we shut down that language, if we just use some drug to Tylenol to shut down the fever or
manage the symptom,
we just manage that, the body stops communicating. And it doesn't then have any energy to communicate anymore. So that is when you drive these diseases to become deeper, more complex, and then all of a sudden you wake up and I got pancreatic cancer.
Yeah.
Yeah, you started out with some other form of cancer. You do a very, very heavy chemo approach, shrinks the tumor, which is how cancer success is measured today. Did it shrink it enough for a long enough period of time? Oh, it did. Good. Then it was successful. And it might go into a slight state of dormancy as the stem cells, the things that make up cancer, go deeper and deeper into anonymity, hiding, whatever you want to call it, some kind of suppressed state. And then all of a sudden, bam, it explodes back out, as you said. Diagnosed this time because it's taken up residence in the pancreas. They say to you, get your affairs in order. This is 97% fatal.
Yeah.
And
especially pancreatic. And, I just had my 40-year high school reunion. And
oh, boy.
During the reunion, one of my really good friends died of cancer.
During the reunion.
Of pancreatic cancer. And she was the picture of health. If you look at her from a standpoint of she was thin, she looked, but it was just bam, gone. And we had another person there that was suffering from cancer, colon cancer. And we've had so many people, everybody kept whispering, why is everybody dying of cancer? Why is there? And, like Dr. Lee said, Dr. Royal Lee, who's our mentor and yours too, back in 1935 or something, said, we're trying to correct the problems of starvation with poisons, basically. So it's a systemic problem that we have to, and foundational problem we need to correct.
And Jack, you made a great point there in regards to, we're looking at the war on cancer, and the only tools that we've had, and it's pretty much the same tools, with different shades, which is you either burn it, you use chemicals, chemo, you poison it, or you cut it.
Yeah.
So these are the three different tools that they've used since the 50s. And we might have gotten better chemotherapeutic drugs, but in essence, we've only increased the average survival, 5-year survival, from like 2.1% to I think is like 2.7, 2.8%.
Wow.
If a
We're
person
talking days.
Yeah, exactly. So
just days.
Exactly. So, but then you're looking at what is my quality of care if I get the chemo? So here I'm going to lose my hair. Here I'm going to feel awful. I'm going to be nauseous. I'm going to be wasting away. And yes, I may increase my chance of living by 2-point-some%.
Yeah.
Is that worth it?
Yeah.
So what we do in our clinic is that, even though you're doing that, the key, maybe you do the chemo and that is your whole family says you need to do this. We want you to live. And that's a model that you follow. But if you at the same time then use natural intervention, use other therapies along with it, then you can then maximize your chance of living, and you can also negate some of the negative effect of the chemo, and you can even potentiate it, like using something like quercetin, like in what you would have in Cyruta Plus, for instance.
The rutin.
Yeah. You would have that bioflavonoids, and what they've seen is that by combining that with chemo, it interferes with the cancer cells. They have like a pump where they actually spit out the chemotherapeutic drugs. So the cancer cells, they have all these defense mechanisms. They spit out then that chemotherapeutic drug, and adding something like quercetin or the Cyruta Plus, it will then stop that pump from functioning. So you can then use very targeted nutritional supplements to maximize the pharmaceutical care that you're getting, in addition to then minimize the negative effect from it. So that's why it's so beautifully work hand in hand. And you shouldn't. It's not do this or do that. It's that intervention. You bring things together. You bring the best of both worlds together, and that's when you can then maximize the care, maximize the outcome. I mean, we had a patient. We're talking about pancreatic cancer. Had a patient that was just declared free of pancreatic cancer.
Oh, that's awesome.
It was just a couple of weeks ago. We had another patient. We have a 2-week therapy, a 2-week intensive program. Patients come in and they get treated with all the different things that we do. And in 8 days, her breast tumor shrunk by 60%.
Wow.
So we could watch that with ultrasound. You can see it shrinking. And it's really exciting to see how you can combine these different therapies.
And that's the holistic approach that you take in the integrative center that you have. It's called the Karlfeldtcenter.com, right? You can go there.
Absolutely. They can go to the Karlfeldtcenter.com, and then we have a page there that's on naturopathic oncology and all the different therapies that we offer. And one of the exciting therapies that we use, there aren't that many United States that use. It's called photodynamic therapy.
I wanted to talk about this. This is exciting.
And what that is using light. Light is a powerful, powerful source. I mean, we would not be alive without the sun. Obviously, that's what create the photosynthesis, and also it drives the mitochondria. It drives the energy production within the cell. So light is an essential building block of life. And because of our environment, and because most of us are inside, we are all deficient in light. And I think that is one of the factors also that is driving cancer. We're inside, we're working, we're not outside, we're not enjoying life the way it should be.
Yeah, and ironically, we're taught that the sun causes cancer.
Yeah.
When to this day, one of the standard treatments in a lot of European spas is sunbathing.
Yeah, heliotherapy. That was huge. And they've done studies on it, actually, where you have patients dealing with, let's say, diabetes, for instance, and you expose the pancreas to 20 minutes of light, sunlight every day, and the blood sugar regulates itself.
Whoa!
So sun has a healing power, and this notion, to be so afraid of skin cancer, it really, what they've seen is that if you support your body nutritionally, you really don't have that skin cancer. They did studies on rats where they had a group where they supported the rats nutritionally, and then another group that they didn't, and they exposed them to equal amount of sun. And the one group that were not supported nutritionally developed skin cancer, and the other one didn't.
Yeah.
So the skin cancer is not due to too much sun. It is due to a nutritional deficiency.
Immune dysfunction.
Yeah, certainly.
Yeah, and in our class, the one lady that died of pancreatic cancer, it started with melanoma. And, so they actually announced, everybody use your sunscreen. And, I was trying to scream, but I couldn't. I mean, I guess I could have, but they, Anyway, so I told people one-on-one, I said, it's a failure of the immune system. It's not the sun. We have humans, not rats. We have humans have worked out in the sun for...
Well, there's another study right there of how many billions of human beings are in the sun every day, all day long, in various countries around this planet, especially in tropical zones where they get a lot more sunlight, who don't have skin cancer.
Yeah, it's a failure of the immune system.
And how many of them slather all these
toxic
exactly chemicals on their skin? And I would say that is probably what is causing the cancer.
I agree.
Yeah.
Well, the skin is a sponge. We got to remember that. It's not a barrier. It's a sponge. And anything you slather on your skin is going to go into your bloodstream.
I mean, you can taste it.
Or at least the lymph.
You put an antiperspirant on, you can taste it in your mouth a few minutes later.
Yeah, it gets directly, and that's why you can use an essential oil for using the same benefit. I mean, you know that the skin will then absorb pretty much anything. Or you can rub an avocado on your skin, and you'll be eating that avocado through your skin. So anything you put on your skin, it will be absorbed. So that is a crucial point. So in regards to the therapies we use, the photodynamic therapy is actually a way then to use intravenous light therapy. So it's an optic cable that has a laser light that you introduce intravenously. So every time the blood passes by that optic cable, it gets treated by that light. And you can use different frequencies. You have like ultraviolet, blue, green, yellow, red, infrared. And it depends on what kind of health conditions you're dealing. Each color, they have a different effect on the body. They all work on the mitochondria in some fashion, turn on a certain component of the mitochondria that turns on energy production.
ATP, yeah.
ATP. And more is coming out about that cancer is more of a metabolic disorder.
Yes.
Meaning that it is a dysfunction of the mitochondria rather than a genetic dysfunction. And that it is because of the dysfunction, the mitochondria, the genetic dysfunction is not corrected. It's a mitochondria that supports a repair of the genes.
Well, that old theory is pretty well being thrown out now because there are just too many people coming out with cancer and there's no cancer history in their families whatsoever.
And Dr. Thomas Cowan talks about the BRCA1, BRCA2 gene and how they've conclusively been able to show that doesn't predispose you to cancer any more than other things. Than not having it or having it in your family. He describes it much more eloquently than I can and in better detail. But I think that's leaving. Although I heard it all weekend at this 2-day reunion that we had that, my aunt had cancer, my grandmother had cancer, my sister had cancer. Oh no. And then I think, the epigenetics of that creates cancer in some respects to where you're so frightened of cancer that the emotional aspect, the nutritional aspect, you should have seen the food they had at this reunion. It was so horrific.
Name one thing that wasn't loaded with sugar.
There wasn't.
Even the meats.
And hydrogenated fats and terrible things. And these people, sugar is the only legal drug in Utah. And I think personally that and the vaccinations are driving a lot of this. And then tremendous amount of bad oils in these salad dressings that everybody's eating.
You say that sugar is the only legal drug. I don't think that's what you meant.
I did.
I think you mean it's the most common drug accessed to everybody else that does not require a prescription. Because there's a lot of legal drugs in Utah.
Well, there's getting to be.
I know what you mean, baby. I know what you mean. But it is probably the most commonly
There's
used
so much sugar in Utah.
Right.
It's just crazy. And we don't think one speck about it. It doesn't even cross our minds. And as you said, and Thomas Cowan said, cancer is basically a metabolic disease.
It definitely is. And if we can then correct that metabolism, you can utilize that to your benefit when you're working with a cancer patient, because you know that a cancer cell uses a fermentation process rather than driving the energy through the mitochondria. So if you use tools to turn on the mitochondria, and we have things like as a product called poly-MVA that we use, or you can use oxygen. We have hyperbaric oxygen therapy. Another tool that we use is called Hockets. And so you can use all these different tools to turn on the mitochondria and then also shut down then that fermentation cycle. There's a couple of things that is actually FDA, or I should say it's being studied in regards to cancer. One is called DCA, or dichloroacetate, and that's a substance that blocks the fermentation process. So if you can then starve the cancer as well as supporting the oxidation of the cancer, and you can use natural tools to increase that oxidative process, the increase of reactive oxygen species within the cancer cells. So what we do is that we introduce intravenously what's called a photosensitizer. Like curcumin would be a photosensitizer, so which means that it will draw light to itself. And so if you introduce a photosensitizer intravenously and you allow that to collect in the cancer cells, and then you expose it, and also you introduce oxygen, so like hyperbaric oxygen therapy, or you can even do ozone IV, something that will bring oxygen into the cancer cells. And so now you have oxygen, you have a photosensitizer, and then you expose it to light, which will then create a reactive oxygen species from the oxygen that is now inside the cancer cell, because that light will draw, or that photosensitizer will draw that light into selectively the cancer cells rather than every other cell. And so that is the new exciting therapy that's coming out.
Cell?
And it oxidizes the cancer cell.
Okay.
So it's exciting information. It's Dr. Michael Weber, he's one of the leaders in Germany. So it's a German technology that we're using in our center. You have Dr. Michael Hamblin, he's on the East Coast. He's probably one of the biggest researcher in regards to how to use light to treat things, to work on cancer, to work on other kind of metabolic disorders, on Parkinson's, on TBIs, on neurological conditions. On Lyme disease. So there's so many applications using something so safe, so benign, so natural as light.
What about light beds?
Light beds are great. It also depends on what kind of light. So we have LED has come out far, and you can use a lot of LED light to impact the body and its well-being. But laser light is it just takes that a step further, and that's what we use in our clinic, both intravenously, and you can also bring that close to where the tumor site is, so you can break the skin barrier and ultrasound guided, then get to the location and then expose that tumor cell directly to light.
Isn't that amazing?
Yeah,
wow.
It's fascinating what some of these integrative doctors are coming out with, and it's really incredible.
So with the pancreas, you could expose it to light, take our long life energy enzymes there to help rebuild that and support that pancreas, and that could be really
absolutely
exciting.
That'd be a powerful tool. Those enzymes, and that's with Dr. Gonzalez, the William Kelly protocol.
Dr. Beard.
Yeah, Dr. Beard, using enzyme, because they see that the pancreatic enzyme is what circulates in the bloodstream, and it's kind of like the police force checking to see what kind of cancer cells are floating around,
mutated cells,
and a lot of us, just because of our garbage food that we're eating, we put so much stress on our poor little pancreas, all that sugar. So it barely has enough energy to digest the food we're eating, let alone then to produce more to police the body, to control then the level of cancer cells.
One of the early diagnostic measures of pancreatic cancer is elevated pancreatic enzymes, because the pancreas is falling apart.
Exactly.
From the stress.
Yeah.
And so tell me, dietarily, what do you do with people besides these other things you've already described? How, even before that, let me ask this, how much involved is the medical oncologist when you're consulting with a new cancer patient?
So my goal in my center is to make sure that, because a lot of people, they choose to do chemotherapy, and and it's not my job to say do or don't.
Right.
I tell my patient, they ask me, if you're in my position, would you do chemotherapy? And I say, where I'm at right now, I would give you this answer. But I don't know. I'm not in your position.
Well, for soft cancers, chemotherapy has a really good outcome. Hard cancers, it's not as good.
Exactly. So chemotherapy can shrink cancer all day long. So it can shrink a tumor, but does it cure the cancer? No, it doesn't cure the cancer. It shrinks a tumor, And the issue is so that it cannot kill all cancer cells. So what do we rely on to, after we shrunk the tumor or after we cut out the tumor or we radiated the tumor just to make it smaller? What do we rely on after, to mop up the rest of all the cancer cells that are there? Because it cannot get rid of it all.
And that's usually where you're left with a normal treatment.
Exactly. That's where you left. And they really don't have any answer what the next step is. Just they shrink the tumor and then watch and wait. And what they're watching and waiting for is that it will then pop up in another area. And usually it is more aggressive, more chemo resistant. So it is key to combine it then with therapies that support the immune system, which is your police force, to be able to mop up the rest of those cancer cells. So, the key is then to always bring in, if you do chemo, to also bring in then something that supports the immune system at the same time. And you want to do it strong enough to get the effect that you want, because otherwise it is just going to relapse.
Yeah, and I love that. I see that all the time. So people, they get their breast cut off, or oh, I'm cured. Oh, I'm in remission, and I'm like, what are you doing? Because it's systemic. It didn't just pop up. I love the analogy you gave of the neuropathy in your leg. Go ahead.
Yes, I tell patients all the time that you cut out the tumor and all of a sudden you think that you're cured from cancer. Well, it is just like diabetes. It is a systemic disease.
Yes.
So let's say you have neuropathy. You got diabetes and it causes neuropathy in your foot. So by cutting off the foot, have you cured the diabetes? No, you haven't.
Yeah.
It is still there. You eliminate an area that is a symptom.
Yeah.
The tumor is just a manifestation of what's going on systemically, and you have to correct what's going on systemically in order to be able to address cancer. Just to get tumor focused, you're not going to be able to solve anything. You may possibly give yourself time, and I'm saying possibly, because if you would have done nothing, studies show that you will live 2.7% less time if you do nothing.
Yeah.
And
sometimes the treatment itself kills you too.
Exactly.
Yeah, which is very sad.
Yeah. So they look upon success. We get rid of the tumor. I mean, the patient died, but the treatment was successful because we got rid of the tumor.
Often that happens.
The key is to look at the patient.
Yes.
We want to address all factors of the patient.
Yeah. Really love that. I feel like that's kind of what happened with my dad. He was 91, so he died, but it wasn't a tragedy, but he got pleurisy. He got an infection in his lungs, and they cured the pleuris. They cured the infection in his lung, but in the meantime, destroyed his microbiome. He couldn't even rebuild with raw eggs. He kept losing weight. His ability to digest food was so destroyed. So, but they fixed the lungs. They got the infection out of the lungs, but he died, and it wasn't a pretty death either. It's not fun to die of starvation, basically. You can't absorb any nutrition to heal your body. So that was really prescient in my mind when that was going through. Yes, you're getting rid of this infection with 3 different very, very powerful antibiotics, but what is it doing to his gut?
And more and more doctors are recognizing that they have to stop becoming so disease focused.
Yes.
And you need to start
myopic.
Exactly. You need to start to focus on the patient.
Yes.
And so you got to look, and when people come to my clinic, then we look at the whole. We look at the emotional component. We look at the spiritual component.
Beautiful.
We look at the diet component. We look at then also the nutritional component. So you want to look at all in your ability to detoxify. How's your liver doing? How's your colon doing? I mean, if you're not able to move toxins out, then how can you bring nutrients in?
Yes.
So you got to open up the pathways of elimination in order for the body to start to accept nutrients. And then we look at, do we need to have stronger interventional care? And then we look at what that is. And we offer a huge list of different things at our center that is not really available in many other places. So but you cannot forget the fundamental pieces, and that is, how are you doing emotionally?
Mm-hmm. Do you have
Where
a therapist on staff?
We do.
Oh, that's awesome.
Yeah. So you got to look at the emotional component. You got to look at the diet, and you got to look, is the patient moving? If the patient is not moving, they're not going to get better. Mm-hmm. So those are the three fundamental components in order to be able to address everything. And then you add all these nice therapies on top of that. You know, photodynamic therapy, oxygen therapy, intravenous nutrition, whatever it may be. You add that on top of that. But all those other things, they are exactly that. If you don't have the foundation, you cannot build upon anything. You may change things for a time, but it will not be sustainable.
We did a podcast, number 95, and we just did a follow-up to it too recently. But it was the survivor's story of incurable cancer. And he did what you're talking about, all these different modalities, not just one, not trying to find a magic pill, although foundational to that was the enzyme therapy. But regardless, he did hyperbaric chamber. The list, you can see it on our podcast on number 95, his protocol. And it wasn't just all nutritional, and it wasn't just, the other things. And he actually didn't do any chemotherapy. He had lymphoma, which actually chemotherapy works pretty well on lymphoma, but he didn't do chemotherapy. But he did another drug. What was that drug he did do? Something to suppress or build the immune system. I can't remember the name of it, but it's on our podcast. But basically, it was just all this supportive, foundational, and of course, he works for Standard Process, so he knew how to foundationally support his body. And he's here alive, 11 years later? Mm-hmm. And it was everywhere. The PET scans are on our website.
He stopped the PET scan several years ago because several of them in a row just showed him completely free. Completely
clear, and he didn't want that toxicity anymore. So the x-rays. But it was a beautiful example of the holistic approach to treating cancer. And that's why we were so interested in bringing you on, because that's what you do. Integrative medicine, the very word.
Yeah. And diet, Jack, you asked me earlier, diet-wise, what should you do? And there are a lot of different diets out there. One of the components that I really believe in is that, because there's so much of your immune system along your gut, you got to heal your gut. Mm-hmm. You got to work on that. About 70 to 80% of your immune system is along the gut lining, and you want to maximize that component of your immune system. So,
you have a GAP certified practitioner in your
we do.
clinic.
Yeah, she's amazing. She consults with doctors that deal with cancer throughout all of the United States. Yes, she is incredible. So we use GAPs, and we do kind of like a GAP/keto type of diet. Mm-hmm. And the reason for that is that, like we know, sugar feeds cancer.
Sure.
And the sugar drives that fermentation process that makes the cancer thrive. And that fermentation, even though it may not be energy efficient, meaning that it doesn't create a lot of ATP through fermentation. If the cell would drive through the mitochondria, you would have about more than 10 times the amount of energy.
36 ATP molecules when you go through the normal process.
Phosphorus.
The phosphorylation, oxidative phosphorylation. Mm-hmm. But when you go through that fermentation process, you end up with 2 ATP molecules.
Yeah, it's
unbelievable.
Ridiculous.
Dr. Cowan gives the example that if you were making $36 an hour and your boss came to you and said, hey, we're going to cut your salary down to $2 an hour.
Yeah, how would you feel about that?
And how much harder would you have to work to go to base, to get up to the point where you were just breaking even? He figures it's about 17% harder, and you can't do that. But you think about your body, how much harder it has to work to create that energy, that ATP, to have the energy when you are fueling it with so much sugar that, and instead of all these other good nutrition, oxygen, light, everything, that if eventually just fails.
Yeah, and it doesn't seem to make sense that the cancer cell would move in that direction to produce energy when it's so less efficient. But then if you look at the end product, so that fermentation cycle, it produces chemical that works like signaling molecules to recruit cells around itself to become cancerous. And it also, it stimulates then also the metastasis process. So if you can then address to kind of shift away from the fermentation cycle towards more of using the mitochondria, you will then cut down on all of that signaling. And that's where diet becomes really powerful. Using something like GAPS keto becomes extremely a powerful tool. So to not have that as a foundational piece and just use these, fandangle therapies, whether it's baking soda or popping apricot kernels or whatever it may be.
All by itself.
Magic pill. It won't have any impact if you don't address the fundamental component of your diet. And so that is key.
Yeah.
Well, that's kind of the main thing behind the Forbidden Doctor, as Mary has described so many times, is to go to the foundational cause rather than the needless frustration of managing symptoms.
Yeah.
Which is but that's where the money is. The money is out there managing symptoms. I mean, even, there was a business magazine here I think it was Bloomberg, had an article about how the medical model or healing people is a bad business model. That's what it was. It was an article devoted to healing being a bad business model. Well, for obvious reasons.
Absolutely. You want to have repeat customers.
Yeah.
And how do you have repeat customers?
Well, you convince them to sign up to the club with the first drug and then have them drug dependent for anything and everything thereafter.
And then if they can't afford, then you set up a system to make sure that other people pay for it. So now you have, the welfare system, you have Medicare, Medicaid, you have insurance, you have all these different things. And then these systems will only allow certain types of treatment. So they create a whole business model around this where they can then manage the care versus curing.
You speak of this almost as though that were intentional rather than accidental.
Well, it's a long-term investment too. That keeps them around a long, long time. I know your wife has some issues with autoimmune and everything, and you can't prove it, but she thinks it goes back to vaccinations and, just the medical model of everything, treating everything with drugs and drugs and drugs. And we often give the example of Dr. Royal Lee, who brought out Zypan, and they wouldn't let him advertise it as a digestional aid. But the same year, they let I forget what brand, Camel cigarettes or some brand, advertise their cigarettes as a digestional aid, because you think how diabolical this is. If you fix your digestion, especially the gut, you're not going to have problems. You're going to be able, if you eat fairly decently, you're going to be able to break down the good food, get rid of the bad food, and you'll live a healthy life. But if you start smoking cigarettes, it's a long-term investment. Down the road, they're going to have a patient. So I hate to sound so conspiratorial, because I don't think it is. I think it's just momentum that kind of happened that way.
Well, as more and more research came out,
I want to believe that,
linking cancer to smoking, it became obvious in the disclosures that came out that their scientists knew a long time ago.
Yeah, they hit it.
The relationship between smoking and cancer, and they covered it up.
Yeah.
Just like a lot, the pollution of the water of various industries, DuPont and their history, and Dow and their history, and the Love
damage
Canal, and all these different kinds of things that have taken place where it was obvious to the people at the time, their own research institutions. And it's like William Thompson at the FDA, and he knows darn well back in 2004 they jiggled the figures regarding the MMR and autism. Yeah. They knew back then that there was a causative link, especially with African American boys.
Well, and the chronic,
and they covered that up,
and
all these things get covered up.
The chronic diseases,
they get covered up because of the money that these industries generate. Because,
I would much rather have my child have the measles.
CDC, I think I meant.
Yeah, the measles, the chickenpox, the mumps, the smallpox and the polio aren't around anymore. And I understand there is a time and a place for some things like this. The Black Plague came again. I might consider a vaccination. But for these silly little diseases that they're doing this, they're creating chronic problems. And on the last podcast, we talked with your wife, and I told about this child that had these twins that were just completely damaged to the highest level of autism you can reach. 24-hour care the rest of their life. They're preemies. They were vaccinated up the yin-yang. They had every vaccination you could get, and they seemed normal, except for they were preemies when they were born. Didn't seem like much else was wrong. But they're now 2.5, and they're the highest level. And now you're dealing with this massive chronic disease when, oh dear, you get chickenpox for a couple days, measles for a few days. I mean, mumps. I had mumps. You had measles, you think. I didn't actually.
No, I didn't.
Yeah. And you know, this is what we're not looking at. This is what our bodies are coupled with the food that we're thrown on us to not eat fat and to become vegetarians and not eat proteins, you know, the complex proteins that you get in meat. So anyway, I'll get off my.
Well, I think you're making a good point in regards to the vaccine. And I think there is a strong correlation between vaccine and cancer.
Yeah.
And the correlation is that we are pushing our immune system to not respond. So whether vaccine is working against whatever disease that you're vaccinating, we don't know. There's really no study to prove at any point that it works at any time. Mm-hmm. So, because there has not been a controlled study where you have a group of people that's not been vaccinated versus a group that has been vaccinated and see whether, you know, that disease is less or not.
Yeah, no IRB would ever allow that to take place anyway.
There has been none.
Yeah.
So the issue with cancer is that you rely then, again, on your immune system to be able to patrol and control cancer cells.
Right.
You know, our immune system is amazing. That is the forbidden doctor that we have within us. Mm-hmm. So what vaccines do is that they train the body and shut down what's called a cell-mediated response, which is your first line of defense. And by shutting that down, then you shut down the body's ability to fight cancer. Let's say for measles, for instance, you know, what are the benefits of measles? Well, you think it's a disease. It can't be any benefits. But what they found is that the people that have had measles have less cancer.
Yeah.
So these childhood diseases, they existed there for a reason. And it's almost like nature put them there to train our immune system so that we can fight off some of these more chronic diseases. So it's kind of like you want to avoid a little gust so that you can then have the tornado. You know, and that is pretty much what we're doing. We're avoiding a little measles that comes and goes so that later on we can then have cancer.
Yeah.
There are cancer therapies out there that are involved injecting measles.
Measles virus, yeah.
Measles, they've done it up at Huntsman. They've done it in Central Africa and a few other places where they give them a good case of measles and the cancer disappears.
Isn't that the irony here?
Yes.
We've been fighting using vaccines to get rid of measles, but now we're turning around to inject measles to fight the cancer.
Yeah.
That's amazing how that happens. And then, unfortunately, where that should be front page news across the country, it gets suppressed.
And they say they're safe and effective. That's front page news everywhere. They're safe and effective. It's been shown. It doesn't cause autism, blah, blah, blah. And I don't know. I hate to be so controversial on this because we think that everybody should just be informed, and they're not. And that's what your wife's fighting so much. Just have them informed. We're not pro or against vaccines. You know, it's just you need to have informed consent. These little 20-year-old parents go in and they're told that this vaccine is safe and effective, even on preemie babies. You know, I had a nurse tell me one time, she says, I have to quit my job. She said, I only work about 2 days a month anyway to keep my license up. But she was in the NICU. That's where she worked, is in the hospital, in the part of the hospital where they have the preemie babies. And she says they would walk in with these vaccinations on these preemie babies who have no immune system to speak of anyway, besides the fact that you can't create antibodies until you're about 12 months old anyway towards these diseases they're being vaccinated against. But they would walk in with these needles and she put her hand up just like this. I know you can't see it, but she would say they wouldn't check their charts. They didn't see if the parents didn't want the vaccinations. They're preemies. She goes, I'm a nurse. I'm for vaccinations, but not on preemies. And they walk in and just jab, 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 just go right down the line and jab.
And what are they dragging along behind them?
Crash cart.
The crash cart.
Because their heart will stop. They drag it behind.
And so she can't be a part of it anymore. She had to quit that job.
She's like, I can't do this anymore. I can't be a part of this, even though my training, my profession, my career is everything towards vaccines save the world. But she's changing her mind on that, and
a baby's brain and neurological system is not developed enough until they're about 18 months old.
Yep.
So any kind of vaccine prior to that will then just pass into the brain. So the aluminum, the formaldehyde, the polysorbate 80, all of this junk will just go directly into the neurological tissue.
Well, any textbook will tell you on immunology that prior to 12 months, the humoral aspect of one's own immunity is not effective. They can't make an antibody before they're about 12 months
Exactly.
old.
So it doesn't make any sense then to do it prior to.
The first 5 months of life, they've got mom's antibodies floating around inside of them. They've got the innate aspect of lysosomal effect and these things. But it's not until they're about a year old they can actually make.
Which is what the Japanese, they don't vaccinate until 2.
And it's fascinating to me. You have all these warnings on herbs and supplements.
Yes.
Do not take if pregnant. But here they are they flu shots. They vaccinate them. Do all these different things, and none of that has been tested on pregnant women. So you have no impact.
You're testing them when you're doing it. That's
exactly.
the test reason.
Yeah.
I have a question for you. Now, polysorbate 80 opens up the blood-brain barrier, and they use it with brain cancer patients to bring the chemotherapy into the brain. You have oncologists on staff. Do they make that connection? Because I suspect they're pro-vaccine because they're just medically trained. Do they make that connection when they use polysorbate 80 with a brain cancer patient, knowing that that is in vaccinations? Or do they just think they're saline in water and a little virus?
Yeah, they really... medical doctor is a medical doctor. Our medical oncologist, he's been medical oncologist for 40 years. He was a consultant for the Gerson Clinic down in Mexico, and so he has a lot of understanding of the integrative aspect. At the end of the day, though, he is still an oncologist, and that is what I want to have him there for.
For sure.
I don't want him to be exactly like me. I want to have somebody that argues with me.
I just wondered if he made that connection,
I don't think that he has.
Obviously, you want to use that with brain cancer. I'm all for polysorbate 80 with brain cancer, but not in vaccinations. And I know he's not a vaccination doctor, but I just wonder if, and you don't think he has. To me, I grew up with medical doctors, and, I can't understand. Like, my dad would send out all these, he was a dentist too, and he would send out all these patients for periodontal disease to go get transplants and sew in gum into their teeth, when a little Cyruta-Plus, as we talked about at the beginning, would have solved this whole problem. And Dr. Royal Lee was around, Standard Process was around, but the myopic view of, I'm a cancer doctor, I'm a...
well, it's like Dr. Hall. When I went, I had some sinus surgery done. They use Clorox-based chemical to purify the tissues and everything, or clear to clean them out. And Mary had a great discussion on ozone therapy with this ENT doctor. And by the time Mary got through to explaining, he says, that makes perfect sense, but you got to understand something. My hands are tied. I'm trained in Western medicine. I can't do that.
Yeah, and that is what people need to recognize, that medical doctors, they're bound by standard of care.
Oh, absolutely.
They'll lose their license.
Which means that if they don't follow standard of care, like you said, they will lose their license. And the amount of effort to change standard of care, which it is tremendous, which means that the medical profession are always going to be at least 20 years behind what science is dictating.
Their own science.
Their own
journals.
Exactly.
Yes.
Exactly. So recognize when you go to a medical doctor, this is who they are. This is what they're bound by. It's not really... it's not really their fault, because they know that if they step outside these guidelines, they will lose their license and they won't be able to practice anymore. So it is important as a consumer.
It's our fault that we don't know.
Exactly. At the end of the day, it is your body. It is your decision. So it is important that you educate yourself as to what is the best for you. And then realize that, yes, maybe your medical doctor will say, so-and-so is what you need to do. But realize when they say so-and-so, it is within the framework of standard of care that is about 20 years behind what science is finding right now.
And my whole high school class is dying because 20 years behind.
Amazing.
Exactly.
Yeah.
It's amazing how many of them have cancer, had cancer, or have died of cancer.
It was scary.
In a class of, about 200 and something?
Maybe I don't know.
250?
Probably about that.
Well, we are coming towards the end of an hour.
I would like to give your URL for the website.
That's what I'm going to wrap up
But your
with
name
here.
is Swedish, and so we will have to spell this. So everybody get your pencils and pens out, or your, iPhone, and put a contact in. Go to the Karlfeldt.com, and Karlfeldt is spelled
Karl, F as in Frank, EL, D as in David, T as in Tom. It's very romantic. It means Karl that lived by a field.
Oh,
Karlfeldt Center. That's all one word, thekarlfeldtcenter.com.
yeah. And you do a 2-week intensive with cancer patients. I'd like you to talk just a minute about that.
We do. So we have a pre-screening process. A patient comes in on Monday, Tuesday. We introduce what's called a photosensitizer. You use that intravenously, and it's something that we get from Germany. And then we use therapies like artesunate, curcumin, oxygen therapies, vitamin C therapies, along with hyperbaric, and then also we use then the laser therapy that we do intravenously. And what they found, I've actually seen how it then gets rid of circulating tumor cells. There was a German. I was at a conference where we were actually able to measure circulating tumor cells live, and we saw before and after. So before we had a measurement of the circulating tumor cells, we did the therapy with the intravenous light therapy, and there was almost none after. So it is astounding, the impact that it has. Along with that, then we work on the diet. We work on the emotional component. We use different detox protocols that you do at the clinic. We also do something's called laser energetic detox, and it's using light and the homeopathic frequency of like the cancer tissue. And then you can then actually use a technique called ART, or autonomic response testing, which is a form of muscle testing where you can then pinpoint and see what kind of chemicals, virus, pathogen, food that may be associated with the cancer. And then you can use laser energetic detox to help to kind of communicate with the body how to turn on or become aware of the existence of it, and then turn on its own healing mechanism. So it's very safe, very holistic. Patient, they're at the clinic pretty much from 9 to 4 every day, and we have tremendous results. I mean, it's really exciting to see how things are turning around.
Do you use an enzyme therapy approach also, with supplementation?
We do also use a supplementation approach. Enzymes is part of that frequently, in addition to other nutritional components, depending on the individual. A lot of times we suggest a person take what's called an RGCC test, which is a test out of Greece, where you can then measure the level of the circulating tumor cells. Wow. You can also then see what are some of the oncogenic drivers, cancer gene drivers, and then you can then match nutritional supplements that will then address that. So let's say your mTOR is very high, your VEGF is very high. So these are different components that drive the cancer, IGF-1. And then you can then guide your nutritional care to address that component. So each person is an individual. So your protocol should be targeted and based upon what's going on within you.
So if you were to go to Sloan Kettering in New York City, how much of what you just described would be part of your initial treatment?
That would be none.
Probably none.
You would be put on a conveyor belt where it would be pretty much the same like everybody else get.
You know, we met you and your wife at Standard Process's 90th anniversary celebration out at Standard Process in Wisconsin, and we just became fast friends. We just seemed like we had the same ideologies, we talked about the same thing, and we just had a great time with you. And this sounds like the answer to many, many people's prayers.
And at the end of the day, it's important that I have patients coming to me in very severe situation. It is a whole lot easier to address it before it happens. So to then start working on your health now, and when you recognize that the odds are, whether it's 1 out of 2, 1 out of 3 that are going to be diagnosed with cancer, then you can see, I mean, if you knew that 1 out of 3 going to be in a car crash, are you not going to wear your seatbelt? Yeah. Well, of course you are. So you need to then start working on your health immediately.
Yeah. Suppose you're in an airplane and the guy comes to you and says, 1 out of you 3 parachutes there is not going to work. Do you still want to jump?
You would prepare better is what you would do.
You'd prepare a lot better.
You'd bring your own.
Let's end this with that. You can wait until the car's rolling down the hillside, or you can make sure that the tires are in good shape, seatbelts are tight, brakes work, all these things ahead of time.
Absolutely.
It's better to build a fence at the top of the mountain than more ambulances in the valley. One of my favorite poems from a long time ago.
So thank you for coming and being on our podcast. We really appreciate it. We want to remind you, and don't forget to tell your family and friends to take our free symptom survey at forbiddendoctor.com, and understand that you will save money because you're not buying supplements or protocols that you don't need. But we are going to be opening this up for more people in a couple of weeks. It's a little pre-launch, a little pre-announcement. We're super excited that you won't have to take the symptom survey in order to purchase supplements from our website. So we're real excited about that. But weirdly, I have to tell this weird little thing. You talk about how we have to have, the horrible side effects of the vaccinations and different things. There are herbs that we won't be able to sell without a consultation, without you taking the symptom survey on our website, because, they could damage you. A little too much licorice can raise your blood pressure, and that's legitimate. I don't have any problem with that. So, but it's just funny the way that we are so held down and so kept in the dark, and we can't know what anybody's health crises are, and we can't put the dots together because we're not smart enough to do that. We're not smart enough we're not allowed. We could strip the names from people and say, this person died of cancer, and here's their medical history. I mean, how valuable would that be? But it's so clamped down. It's so blacklisted. It's so, what's it called when they retract stuff out of
redacted reports are redacted
out of top secret information? They treat our healthcare as top secret, and I think we should have that right to know. Take away the names, don't have it identifiable to any person at all, but open up some of these medical histories. Let us know this forbidden information.
Well, then we might discover the cause,
and it's interesting.
That wouldn't be good.
Yes, and the Iodine Crisis book is so interesting because she had stage 0 breast cancer, but she asked her oncologist, where can I go to read about this? How? He didn't know the standard of care. She said, why are you following this standard of care? He didn't know. He doesn't even know. I don't think even some of the medical doctors can't follow that path. Where did this person start? What did they eat? I mean, you can do studies and stuff like that. It's very hard to study, but I think we should open up all this information so we all can use our own brains to figure out. We just have to look at the history of, just Utah with all the sugar and everything that's done here. We have to look at what happens when kids get vaccinated. But yet, if we talk about it, we're wiped off of Google. I mean, literally, you can't type in, anti-vaxxer into Google. Hardly anything will come up. I've had to go to DuckDuckGo to be able to bring up anything to do with vaccinations anymore. And yet these people are dying everywhere and being maimed everywhere and chronic diseases everywhere. So I'll get off my little soapbox and we will try to bring this to an end.
And I will finish with this.
Okay.
The statements made in this podcast about specific products and or treatments have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or any product label or packaging or this podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professional.
So thank you.
Thank you so much for having me. It was truly a pleasure.
Yeah, it was really fun. And thanks for listening to the Forbidden Information and Our Forbidden podcast. Join us next week or next time for another discussion of forbidden knowledge, and we will see you then.
All right. So long, everybody. Many of you may be finding us for the first time. Keep in mind the protocols on our website and what we are talking about are only available to logged-in users. But you can create an account instantly by taking our free no-obligation symptom survey at forbiddendoctor.com. Understand the survey saves you money in the long run because you're not going to be taking supplements you don't need. And all of this at no charge to you. And if you would like 20% off all the time, join our VIP membership. Just go to forbiddendoctor.com/VIP to listen to a short video on the benefits, and let's start your healing process today.